evening and welcome to Thai PBS World tonight. Right now, Kun Thep Chai Yong is joining me live from home. Kun Thep Chai, state of emergency and curfew seems to pay off with the new infection today is about 38 new cases.
Yes, if we want to take that as a positive indication of things to come, then we may as well do that. But of course, I mean, doctors, medical experts are trying to caution against any over-optimism. Because even though the number of new infections today stood at 38, the lowest number in weeks, we still cannot lower our guard, as the experts say today, because they said they would not be surprised if the number of new cases tomorrow rebounds and go as high as 50 or more than that, because the doctors, I mean, involved in this scenario try to point out that there is a specific calculation method for the number of cases confirmed and to be reported, and there is a sort of a cut-off time in the evening. By that time, not all the cases might have been taken into consideration, so that's why the figure we see today may not really reflect the actual situation.
Yes, especially according to Dr. Thanarak Palikpat, Deputy Director General of Department of Disease Control, who had an interview with us at Thai PBS World tonight. He also mentioned the point of perhaps incomplete picture of lab results. That's why the total figure for today is quite low. And he said, don't be surprised if tomorrow the number has risen.
The numbers show the decreasing trend of COVID-19 in the countries, but as we observed in the past, that the figure is still varied quite a bit. So to me, I believe that we are having decreasing trend, but don't be surprised if the numbers for tomorrow going up a little bit again. I believe it's the variation of day by day. The number of it is by technical that they cut the numbers at certain times, that they include the numbers. The testing may be positive, but during the weekend or during the long weekend, the reporting may be a little bit delayed. So that is probably maybe the explanation of the variation of day by days.
But one of Dr. Thanarak's biggest concerns is the misperception among many people, I mean, toward the epidemic. Many believe that if there are any infected people, I mean, moved into areas close to where they live, close to their community, then they would be in danger of contracting the disease from these people. So a lot he believes needs to be done to educate people so that they may have the right perception of what this disease is really about.
And also with the capacity of the testing, because today the medical personnel have been asked what's the capacity and whether we can have faster testing. Dr. Thanarak also told us that if we compare what the medical lab can do right now is much faster than before, especially when compared with January, in which each day they can know the lab test results for only about 100. But right now, overall in the country, the medical doctor can do for 20,000, about 10,000 in Bangkok and about 10,000 more in provinces. So totally, so far, what they can do is about 70,000 of test results.
If you look back, I believe that we have done quite a good job on this, and I think we should give credit to everybody involved. If we go back to the times of around early January, if you could remember, at the beginning of January, we have only 2 laboratories that could perform the test, and the number of the laboratories that can perform the test went up very, very fast. Today, we have the capacity of being able to test more than 20,000 samples per day. going up from just around 100 or 200 in the beginning of January. If you consider that we are still developing countries, and with the capacity that we are trying to expand at this rate, I think everybody should be satisfied on the effort of everybody.
For a country like Italy, Kuntepchai, the situation is still quite critical, and it's been almost a month already that the whole country is under lockdown.
Yeah, but it looks like there has been some positive side over the weekend when the number of deaths has started to decline, even though not by the large percentage, but it's a good sign that for the first time that we see a positive side that things are maybe on the right track.
An ambassador of Italy to Thailand has also joined us in the program, and he also tell us about how the government is handling the situation right now.
The great challenge is the intensive care units, because what you want to do in this kind of pandemics is you want to make sure that everybody has access to intensive care units. So you want to keep, that's one of the reasons why you want to keep the contagion as low as possible. It's better a longer duration, but with a lower rate of contagion than a spike. Nevertheless, in our case, we had a spike, so the health system was severely under stress. We are starting to see a more sustainable pattern right now. One thing I would like to say, because it's been in the media a lot, not only in Thailand but everywhere, there was the very inaccurate idea that Italy was kind of letting elderly people die, choosing young people to elderly people in what they call the triage. Apparently, if you have not enough intensive care units, you have to choose. Well, we've never really come to that, and I would like to formally deny that this is happening in Italy. On the contrary, we're trying to save lives, and this is the first, let's say, the first goal of our what we call the Italian model, basically. The Italian model is based on a constant dialogue with scientists and health experts. It's based on incremental measures, proportional measures. It's based on transparency towards citizens. We like to inform them. We want them to know what is happening in the country. And this model was recognized as effective by WHO. So I think so far we are quite proud of what is going on. Our health system is considered, globally speaking, one of the best. But indeed, it has been put under a very severe strain.
And the ambassador made it a point to stress that there's no such thing as the Italian coronavirus. Of course, we remember how some of the Thai media, including the news website of Thai PBS World, reported about a new strand of coronavirus originating in Italy, which turned out to be something false. And the ambassador quoted the medical experts in Italy as confirming that there has never been anything that is scientifically proven to be something that can be called Italian coronavirus. So this is a point that I think is very important for Thai people to understand.
As you mentioned, there is no scientific evidence to the theory, let me call it like that there is an Italian coronavirus. In fact, the COVID that was sequenced in Italy by the Italian Institute of Health is not different from the one that was sequenced in Wuhan. So let's say the reason why people thought it would be stronger, and that the contagion in Italy was faster, incredibly fast, was mainly due to the fact that we were probably a couple of weeks in advance from the rest of the world. So we're looking today at other countries who unfortunately bypassed us, and I think of the United States, I think of Spain, and I think of other European countries who have numbers which are comparable.
He also mentioned that economic situation is quite a big challenge for Italy, and it must be having mutual support from European Union as well to try to help out of this crisis, Kun Thepchai. And that's all what we keep you updated with COVID-19 situation tonight from Thai PBS World Tonight.